This morning, the board will be considering approval of a 10-year plan to end homelessness in Orange County. Very inclusive, collaborative process. But this ceremony is a celebration of a mobile multi-service center, which, thanks to our Board of Supervisors, has been funded. And the 10-year plan to end homelessness has, one of the key strategies is multi-service centers, and especially those that are mobile that can go into the community to help the homeless. And so today you're going to be hearing from our members of the Board of Supervisors, the Illumination Foundation, the Healthcare Agency, and the City of Santa Ana about this wonderful resource for our community. And so without further ado, I would like to introduce to you our Chair of the Board of Supervisors, Supervisor Janet Nguyen. Please give her a warm welcome.
Karen, I'm a little shorter than this. Good morning.
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 Colleagues, county staff, and guests. I am pleased to be here today to present to you the Mobile Multi-Service Unit. The Mobile Multi-Service Center was developed through a partnership between the County of Orange, our CEO's office, and I know Mr. Tom Mock is here, Orange County Community Services, the Healthcare Agency, and the Illumination Foundation to provide a one-stop service center for the homeless or those at risk of homelessness. The mobile unit brings services to homeless families and individuals in places where they are likely to be, and is part of an effort to overcome some of the many barriers that prevent needy individuals and families from receiving accurate services and becoming housed. Both through my involvement in the Civic Center Task Force and my visits to the Army shelters demonstrate the critical need for these services. In an effort to identify solutions to address homelessness, I chair a Civic Center Task Force. With the support of the Orange County Community Services, a task force of agencies was formed to develop and implement proactive strategies to address the issues facing the homeless in Civic Center. The task force was comprised of the following agencies and representatives: Supervisor John Morlock and his staff from the 2nd District,
Thank you all for coming in. This is a fantastic solution that our own county has developed, given the uniqueness of our county. I do want to talk a little bit about the timeline for how we got here. Also to explain to you, I think, why my interest in the homeless issue and so many of you others. You know, it was back in the 70s that our state really changed its policy for dealing with people with mental illness. They essentially said, we're going to mainstream them, put them back in society. This will be better for them. And that was a noble intent. The problem was that they did not send the money. They sent the people, but not the money. And reduced the services to those mentally impaired. Now, that's not to suggest that all homeless are mentally impaired, but certainly that created the visible problem, shall we say, of homelessness. And it always struck me that we had some good intentions, but had not fulfilled them in supporting that side of the community. So when I was in the Assembly, I actually worked with our current Senate Pro Tem on a number of homeless issues. And then when I got here, where the rubber meets the road, where the dealing with the homeless actually occurs, I did get involved with Karen Roper and with others on what we could do about it. I want to acknowledge that I think the CEO and I are in alignment on this particular need and desire to help those both economically challenged and mentally challenged that creates the causes of homelessness.
I want to thank Phil Mangano the Bush administration's homeless czar, if I can use that term, the former executive director of the United States Interagency Council on Homelessness. Mr. Mangano, now retired, shared the vision on at least 2 separate occasions in the last 2 years with those communities serving the homeless in Orange County. And myself and Supervisor Bates had the privilege of meeting with Mr. Mangano, who was an evangelist for this cause and was just a delight to work with. We are thankful for the opportunity to partner with the Homeless Prevention and Rapid Rehousing Program and the many Orange County-based nonprofits like the Illumination Foundation in assisting in this 10-year vision.
Thank you, Karen. Some 30 years ago, I know I don't look that old, but I am. I was a social worker in the County of Los Angeles, and this was a very pervasive problem for us as social workers to address homelessness, a very complex issue that involves personal socioeconomic components that certainly challenge the best of us. So to come full circle and be here today amongst you, it's an exciting moment to be a county supervisor who's had the opportunity from the work of all of you to assist my cities in addressing these regional issues, homelessness following us for those many years, and now we're confronting it and going to take the services to the people who need them. As a result, the 5th District has been very involved in planning meetings with county staff from the Orange County Community Services and the Healthcare Agency to support the South County cities in the development of strategies and resources to address the homelessness.
How do you help someone without making them helpless? This is a central dilemma not only of government, but of us as human beings, as us as parents. How do you give someone the freedom to fail and still protect them from the consequences of that failure? It's a challenging dilemma, and I'm proud to be a part of the solution here in Orange County. Homelessness has many causes, from poor life choices to things that are out of people's own control, to a combination of those. And the solutions are equally complex. Every day, walking through the Civic Center, we see those who literally have no place to go. Or they have a place to go, they just don't know it. Or the place to go is the place that they've fled that they don't want to go back to. Every story is different. And I'm proud to be part of this 10-year plan.
I want to applaud the efforts of all of you, especially the Board of Supervisors, because this is a very difficult thing to do. You know, we right now in government have so many things coming at us. It's such a moving ball. And yet to find the courage and the will and the money to address this much needed issue. For us here in Santa Ana in particular, with our unique relationship between the city, the host city, and the county of Orange, this is really a welcome sight, especially because it's out of the box. It's thinking out of the box. It's a mobile unit. So many of the homeless, in many cases, and Jim would know this and others, they don't want to be indoors. It's so beautiful if you can enjoy freedom being outdoors. And this mobile van, in a way, I think is going to reach so many people and help them in a significant way. It's incumbent upon all of us to continue to support all the other organizations, because, as has been said, homelessness just has so many dimensions. And whether it's the Rescue Mission or Wise Place or Orangewood, all those are part of the solution. The solution's multifaceted, and we have to be open to that. But this, I think, is just a key, because it will reach out to folks that otherwise wouldn't have that ability to brush their teeth, possibly, or to try to figure out where they can go to help, and just to take that next step to get to tomorrow and make tomorrow a brighter day.
Board of Supervisors, CEO Karen Roper, Dave Riley from the Healthcare Agency, Paul Leon, dreams can come true. I am absolutely convinced. And I think about 3 years ago, when Paul Leon and myself went into the Armory and saw what we saw, and the families and children in the Armory, to where we are today, where there are no families in the Armory, is just a dream come true. And I've been criticized for not telling the story right, but this truly is a starfish story. It started with saving one starfish at a time. And this effort became a labor of love. It consumed all of us. And it's just tremendous that we have this public-private partnership, and we are really making headway and becoming successful. So I want to thank everybody for their support. It feels like for me today that I'm home. So thank you.
Thank you, Board of Supervisors. It's really amazing to be here after that 3 years of multiple meetings, multiple phone conversations. And I have to first acknowledge the board, because each and every one of them have come out to the armories. They've come out to the initial mobile vans that we were running. And without your leadership, we wouldn't have been able to do any of this. And I know about 3 years ago, I remember talking with Supervisor Campbell, and he was talking about the multi-service center that we were hoping to one day have. And at that time, it was just an idea. And to be able to actually come and do this today is just a miracle. I first of all have to really thank Giving Children Hope, who partnered with us in allowing us to use their van. Kaiser, we use their physicians. We have partnered with, of course, the healthcare agency and using their public health nurses, SSI, SSA, and of course the staff you see behind us. I can't tell you how many nights we were either in Laguna, South Orange County, Fullerton, where it was absolutely freezing. And we could just get a touch, just an idea how our most vulnerable population has to live. I mean, we've actually been out there at midnight, 2 in the morning, helping people, so we have a really good idea of what they're going through. But unless we're homeless, we never really know. So I just want to thank our staff, our mental health, all the people that helped us do this, because of the fact that they really are trying to put themselves in the position of some of the most vulnerable population that we serve. And I remember when Dr. Handler and I were doing presentations last year, 2009, and we went to probably about at least 50 different organizations. And one time Dr. Handler asked a group, who do you think's responsibility it is to help the homeless? And they were quick to say the county. And they were quick to say, well, if it's not the county, they were looking for an entity, one single person to help the homeless. And of course that can't help, that can't just have one organization to help the homeless. It has to be all of us. And I just want to recognize real quickly, Joe Mothershead, can you guys stand up? And Nancy McIntyre. I was so inspired by the work they did in South Orange County. They were coming out helping homeless on their own, just citizens doing what they could to help the people in their area. And so to be able to bring the mobile van down there as a platform to partner with grassroots organizations, their group's called I Hope, to work with them. They know their area better than we do, and to partner and bring all the resources to them, it's truly a collaborative effort. And when people ask us all the time, how are we going to do this? How are you going to end homelessness? Well, to be honest with you, I don't know. But as long as all of us are working together, we have the public involved, we have great leadership, I really think one day we'll sit here and say, you know what? We have helped as many homelessness people, individuals as we can, and at least we have some solutions. So I want to invite you all at the end of the meeting or at the end of the 10-year plan to tour the multi-service center, and you'll see we offer like job placement, we offer housing solutions, we offer a lot of different things that connect one individual in one stop to different organizations. So thank you very much.
About the mobile clinic and what's going on here.
Actually, this is the launch of our new mobile multi-service center, and we are planning on going out throughout Orange County, and it's a multi-service center for the homeless and impoverished. We've been running this van approximately 2 years. We're picking it up now, and we're actually offering job placement, and we're actually offering housing options for anybody who wants to come in and come onto the van. We also have approximately anywhere from 4 to 8 physicians who man the van, and they can write prescriptions and do assessments on patients.
Before you had this, how difficult was it to deliver services to the homeless?
Well, it was extremely difficult. For one, we had to go into the armories, and it was pretty much like a MASH unit. We would use public health nurses and physicians, but we'd have to carry everything into the armory and then carry it out. And we had no other locations in which to go except for the cold weather shelters. Now, since we've started using the mobile van, we've went to San Clemente, Placentia, Oregon, all throughout the county. This year in 2010, we have 10 sites. And we plan on going once a week to these sites throughout Orange County.
Okay. And you know, the big question that everybody wants to know, how are you paying for it?
We get private grants. We receive some of the federal stimulus money to help on the back end. And I think the important thing to note on the van is it is not a medical home. Our real key is to connect people to a medical home. So if we have a homeless individual that comes to see us, our goal is to try to get him into regular primary physician and help him with insurance. We help him with finding a physician that he can afford. And if he can't pay, then we work out all the paperwork for him. And we also help them with transportation, either with bus passes or some community activists that come in and help them get to where they need to go.
We are giving flu shots today for free.
Great!
So it's the H1N1, and we know how deadly that virus can be. So vaccinating our friends here would help them, prevent them from getting any complications, and you know.
And wonderful. And how many people do we expect to treat today?
I don't know. Anywhere from 15 to 50. We have no idea. We'll see.
We're ready for them, though.
Wonderful. Well, that's exciting.
Yes, very